Dear audience, thank you for interest in our research. We would like to present to you the work that the Allergy Department of Cruces University Hospital has conducted on a series of 42 patients with non-immediate hypersensitivity reactions to iomeprol. In this study, we analyzed the usefulness of skin tests with non-immediate hypersensitivity reactions caused by iomeprol, and we calculated cross-reactivity with other iodinated contrast media. The study was conducted with 42 patients who presented this type of hypersensitivity reactions. Specifically, in 38 of the patients, the reaction was caused after administering iomeprol, and in one of the patients after ioversol and iodixanol. In the remaining 2 patients, the iodinated contrast media was unknown. We performed in all patients prick and intradermal tests with the light reading, with iomeprol, iopamidol, iopamide, and iopamidol. And in the patients in which these contrasts caused the reaction, we used iodixanol and ioversol. In all the contrasts, the skin tests were performed with undiluted iodinated contrast media. All patients were challenged with 100 milliliters of contrast based on the following criteria. If skin tests with the causal agent were negative, we completed the challenge test with the causal iodinated contrast media. However, in the patients with a positive skin or challenge test to the causal iodinated contrast media, the challenge tests were done with an alternative negative skin tested contrast. The skin tests were positive in 20 patients, representing a 47.6% of all patients, with delayed reading in all the cases. All these 20 patients were at least positive to iomeprol. Out of the 20 patients, only 15 were exclusively positive to iomeprol. Out of the remaining 5 patients, 1 was positive to iopamidol, 1 to ioversol, 1 to iopamide, another 1 to iopamidol and iopamide. The last one was positive to all the iodinated contrast media tested. We conducted a total of 66 challenge tests with iodinated contrast media in the 242 patients. In 31 cases, the challenge tests were positive, 21 with iomeprol, 6 with iopamidol, 3 with iopamidol, and 1 with iodixanol. On top of this, in 35 cases, the patients tolerated the challenge test with iodinated contrast media, 31 with iopamidol, 2 with iopamide, and 2 with iopamidol. Considering these findings, our main conclusions are the following. Firstly, sensitivity of the skin test was less than 50% in patients with non-immediate hypersensitivity reactions caused by iomeprol. Secondly, the negative predictive value of skin tests in patients who tolerated challenges with alternative contrast was 53%. And finally, the cross-reactivity between iomeprol and iopamidol was 22%. Thank you very much for your attention.